Today we're going to be talking about the Affordable Care Act 2.5 years later, also known as Obamacare. As we know, the Supreme Court declared the Affordable Care Act constitutional. However, we're also going to be discussing what the impact to Obamacare would be from the Romney-Ryan health care plan. Why the system needed repair had to do with little or no financial accountability. In 2008, the United States and the people spent more than $2.4 trillion on health care, and it is expected that this number would grow to $4.4 trillion by 2018. That is more than any other developed country. Medicare has been the single largest payer of health care services in 2008. When it comes to having insurance, most people do have insurance. 52% of the citizens in the United States have insurance. 32% obtain insurance through Medicare or Medicaid, and yet 16% of the citizens of the United States have insurance at all. That represents more than 48.6 million people who were uninsured in 2011, down from 50 million the year before. And they still get sick and are treated, and someone pays. The basic questions: should all American citizens have access to affordable quality health care? Well, the answer to that is yes, with proper planning, cooperation, and new consumer-friendly benefits. More than $400 billion will be needed during the next 10 years to make this happen. New revenue sources plus financial restructuring have been introduced to fund the Affordable Care Act. The Congressional Budget Office has stated the health care law will reduce the projected deficit. Who's going to pay this big chunk of money? Well, new sources of revenue, more than $60 billion for new fees for insurance providers, new fees for imported drug manufacturers, and also new fees on branded medical devices. However, eyeglasses and things of that nature are exempt from these new fees. Federal sales tax on indoor tanning devices, and $210 billion expected to be collected from increasing the Medicare payroll taxes on individuals who earn more than $200,000 a year, and 3.8% tax on investment income for individuals that earn over $250,000 a year. Also, there's been some misinformation regarding the 3.8% tax on real estate sales. Very few people will be required to pay this tax. It applies only when the individual earns over $200,000 annually, and the profit on the sale of the home is over $500,000. The tax is on the profit over $500,000. And there is not going to be an increase in Medicare Part B premium to $247. Medicare premiums will continue to be determined by a formula that has been long established by Congress. Nothing in the Affordable Care Act changes this. However, opponents to the Affordable Care Act are mistaken. $716 billion of Medicare benefits are not being eliminated to pay for the Affordable Care Act. Health insurance companies and providers will be more accountable for the services they provide. The Patient and Protection and Affordable Care Act is going to require insurance companies to spend at least 85% of the premiums that they collect on providing medical care. In the past, they had been paying as little as 68% of the premiums on medical care. August 1st of this year, healthcare insurers had to refund $1.3 billion nationally, and $149 million of that money was sent to Florida citizens. The ACA, working with healthcare providers, hospitals, physician organizations, the AMA, and others, are restructuring fee schedules to reward quality of care. Naturally, this cooperation is going to lead to changes that is going to benefit healthcare providers, Medicare beneficiaries, and all health care beneficiaries. And Medicare, as we probably know, subsidizes Medicare Advantage programs. However, Medicare has been greatly overpaying for the health care services being provided through the Medicare Advantage programs since 1997, compared to the services that they provide. Medicare Advantage programs are provided by for-profit health insurance companies. By eliminating these overpayments, they will realize $120 billion in savings. The dollars saved over the next 10 years will be used to increase Medicare and health care benefits. And Medicare Advantage enrollees will continue to receive all of the Medicare benefits. More than 25% of the seniors eligible utilize Medicare Advantage programs. And are Medicare Advantage programs being eliminated? Absolutely not. The financial restructuring of support for the Medicare Advantage program rewards Medicare Advantage programs that provide high quality of care. Congress estimates the expenses to provide health care services for the uninsured at $13 to $43 billion per year. And who pays for that? The taxpayer, through increased taxes, loss of municipal services and benefits, plus higher insurance premiums. Beginning in 2014, those who can't afford it will be required to obtain health insurance or pay tax. This tax will be used to offset the cost of the health care services provided, not to purchase health insurance. And how much is that tax? Well, $95 annually, or 1% of income if you make $50,000 a year. Or by the year 2016, that will increase to $695 annually. The families will have an annual maximum fee of $2,085. It's estimated that 2% of the U.S. citizens may be affected and that the tax may not even be enforced. When they started talking about death panels, the insurance companies really got nervous because they thought they were talking about them and the way they have been treating their customers for the past number of years. However, what was being discussed was the Independent Payment Advisory Board. This was created to strengthen the Medicare Payment Advisory Board. The IPAB is composed of 15 members with healthcare and economic experience that are appointed by the President. They are not bureaucrats. After consultation with the Senate and House leadership, and are subject to the approval of the Senate. And they are charged with achieving savings in Medicare while maintaining or increasing benefits. The IPAB may make recommendations based on independent healthcare, economic, and actuarial justifications. However, the recommendations may not include rationing of healthcare, increases in revenue, increases in Medicare premiums, deductibles, co-insurance, or co-payments, nor otherwise restrict benefits or eligibility criteria. And Congress has the opportunity to override any recommended changes with a supermajority vote of 2/3. There are no death panels. The government is not taking control of your health care. The fact is that the Supreme Court has declared the mandate okay as a tax. Some lower middle class families are going to receive help buying insurance. More people will be eligible for Medicaid. Insurance companies will have some new regulations. And Obamacare will extend the life of Medicare 12 years, from 2017 to 2000. The answer to the question asked previously, should all American citizens have access to affordable health care, seems obvious. However, many lawmakers don't agree with that, and their supporters don't agree with that idea. Did you know that when we were at war in Iraq until 2012, the United States had recommended including single-payer guaranteed health care for all Iraqi citizens in Iraq in the new government's constitution. That became part of their constitution under Article 31, meaning that all Iraqi citizens have their health care paid for by the Iraqi government. If elected, his first day in office, Mitt Romney has said he will issue executive orders, paving the way for the federal government to issue Obamacare waivers into all 50 states, plus begin to work with Congress to repeal full benefits as quickly as possible. Medicare will no longer pay for annual physicals, eliminating the free preventive care now required by all new insurance programs. They will provide vouchers for future seniors to buy health insurance. But who's going to sell it to these future seniors? There is no guarantee in the Romney-Ryan Medicare health plan that will require insurance companies to provide insurance for seniors who might elect to participate using this voucher system. It is anticipated that this new program that would be proposed by the Romney-Ryan team would cost the senior an additional $6,400 a year. The Romney-Ryan healthcare plan will allow insurance companies to operate deregulated, meaning no protection for the public. They will have free rein for insurance companies to spend less than the 85% on patient premiums for healthcare services, free rein for insurance companies to institute unreasonable rate hikes, and free rein for insurance companies to start imposing lifetime policy limits on health care coverage again. Also, insurance companies will be able to cancel insurance for people once they get sick, eliminate Medicare from rural hospitals. They will also stop the support for expanding the number of primary care doctors, nurses, and physician assistants, including their scholarships and loan repayment assistance for primary care doctors. And they would be eliminating the ability of children to stay on their parents' policies until they're 26 and pre-existing condition clauses. However, the presidential candidate Mitt Romney has now said he would consider allowing these benefits. When it comes to prescription medication for seniors, the Affordable Care Act was a real lifesaver. More than 220,000 Florida seniors received checks for $250 in 2010 because they had dropped into the donut hole, and $51 million was paid out to Florida seniors in 2011. This would be eliminated under the Romney-Ryan health care plan. There is no mention of continuing the Medicare prescription discount benefits in the Romney-Ryan Medicare health plan. The elimination of funding and subsidies for conforming Medicare Advantage programs and the support for the expansion of these popular programs would go away. More than 25% of the seniors do now take advantage of these benefits. Elimination of public health and preventive programs that help keep Americans healthy. Elimination of funding and support for the construction and expansion of services for community health care centers, serving 20 million new patients across the country. And eliminating the financial assistance to employers who help maintain health care coverage for early retirees that are age 55 and older and not yet eligible for Medicare. Also, eliminating making health care more affordable. Tax credits for the middle class would have become available for those with incomes between 100 and 400% of the poverty line. This meant that someone making $43,000 a year would have been eligible for a tax credit to help them make purchase in health care more affordable. If they were a family, their individual tax credit would have been, income would have needed to have gone up to $88,000 for a family of four. And the tax credit would have been advanceable. It could have lowered premium payments each month, and these individuals would have also qualified for reduced cost sharing. Eliminating and improving the care for seniors after they leave the hospital thereby avoiding the unnecessary readmissions, eliminating increasing access to services at home and in the community that offer home and community-based services to the disabled through Medicaid. Eliminating increasing Medicaid payments for primary care doctors. This would have put the physicians who treat Medicaid patients on a level playing field with those patients treating Medicare patients, and the increase would have been fully funded by the federal government. And eliminating the compensation for physicians based on value, not volume. Physicians who provided high quality of care would have received higher payments. And then the elimination of the 2 additional years of the Children's Health Insurance Program that would continue coverage for children not eligible for Medicaid. These expenses and profit margins would again become acceptable, eliminating the fact that less than 2% of the overhead expenses are incurred by Medicare, which means that 98% of the premiums that are now paid into Medicare are paid out in health care benefits, compared to what the private insurance industry does. Healthcare insurance exchanges were going to be introduced to allow individuals and small business to obtain affordable health care coverage through new competitive state-based insurance exchanges provided by private health insurance companies. And the ACA was going to provide states that have applied with grants to support developing these exchanges. Under the Romney-Ryan plan, these are being eliminated entirely. Florida has already refused any of these grants. Elimination of regulations of for-profit healthcare insurance companies and the assurance of fair competition, allowing states to craft healthcare reform for their citizens, regardless of the benefits provided, and allowing the legislature and the lobbyists to control the process. Basically, allowing insurance companies to increase profits by taking advantage of illness and disability. And when it comes to Medicaid, the Supreme Court, although they supported the Affordable Care Act as being constitutional, they did not support the mandatory expansion of Medicaid by the states. States may voluntarily implement this expansion and receive federal funds to do it, which many states have already done. Medicaid, as we all knew, provides health and medical services provided for individuals and families with low incomes, disabilities. 80% of the residents in nursing homes rely on Medicaid to pay for their services. The primary oversight for the program is controlled by the state, however they are subject to federal regulations. And each state has to implement and administer Medicaid services in their states. This is paid for by, currently, the government by 80% of the cost of Medicaid is paid by the federal government, and the state pays 20%. The federal requirements must be met by the states to receive the federal funds, and eligibility standards on meeting requirements are based on age, pregnancy status, disability, etc. The federal government, 2014, was going to assume most of the funding for Medicaid expansion, not the states. The federal government would have been paying 90% of the expansion of Medicaid in those states. Florida is not expanding any of its Medicaid program to include newly eligible individuals and families in need of health care services. Could all of these benefits currently available to all citizens of the United States be repealed? Probably not. However, if elected, Mitt Romney has said on the first day in office he will issue an executive order paving the way for the federal government to issue Obamacare waivers to all 50 states to begin work with Congress to repeal the full benefits as quickly as possible. Repeal of these benefits naturally would significantly impact health care services. Why take the chance? I like my label a lot better.